Okay.
I'll be
Sorry about that. Okay.
And then, okay. So where are you getting a clonazepam from? Which clinic?
Wayne, but she's
Is
there
this
for,
a pain clinic?
no. This is for my anxiety, but she's did it for 6 months. So I mean, I can do it here.
Was it the primary care doctor who
Yes.
was giving
Yes.
clonazepam? Okay, but you're not seeing her anymore.
No.
So you're gonna get from here.
Am I gonna get it from here?
I mean, I'm asking you.
I can.
Because you have to pick one. It's a controlled substance.
Right.
So
No, I'll
it
just
has
pick over there still.
You can still pick up. I don't know if they're gonna refill you if you don't see them anymore.
Oh. Well, she gave me 6 months refills.
Yeah, you have a 6 weeks of refill.
No, 6 months.
6 months. I mean, we can talk about it on next visit. Like,
Yeah,
hey,
yeah.
I'm done with
Because
refills.
right now I have plenty. Yeah.
Okay, cool.
My main thing is honestly just surgery and to get prepped up for
Okay.
this one.
Okay.
The,
And then you had a tubular ligation already.
yeah.
Okay. What is this?
Oh, sorry.
Right tarsal.
Right tarsal. Yeah. They cut the pernal nerve on accident, so it made me have CRPS2,
Okay.
complex regional pain syndrome 2, dystonia, and drop foot. And I went through Smith. If you go through, I can get it I'll get it all fresh for you. But Smith Physical Therapy diagnosed me, and the reason I don't go to them anymore is because it's very hard on me. Like I'll go in there with a 6, but I'll come out as a 10 because they try to do different unique, techniques and stuff. But all it does is just hurt me. So I told him thank you, but no thank you.
Okay.
I'll just do it my side. And carpal boss right here. I have right here.
Carpal tunnel.
No, carpal boss.
Copper box. Okay.
That's what they
Okay.
diagnosed me with physical therapy too.
You're getting physical therapy?
No.
No.
I stopped only because it was making me have too much of a flare up.
Okay, got it.
Even when I do my pedicures, it used to be fun.
Uh-huh.
Now it's like they don't understand because it doesn't look like it, but it's all mangled inside. And I keep telling them.
For your uterus and adrenal
that
gland,
hurts.
can you give me a timeline? When do you start to have symptoms? When they found the enlarged adrenal gland, and then when they start suspecting
Well,
cancer?
this started actually a couple years ago, but it didn't bother me.
How did you know that you have an enlarged adrenal gland?
Oh, because I did a CT scan and it was
What's a
2.0.
primary?
Yeah, with the ER 2.0 times 1.6.
So you went to ED because it's discomfort.
Yes.
And then they did CT abdomen pelvis.
Yeah, and it grew twice since last year.
Okay. All right. What ED did you go to?
That one was Sunrise.
That was a Sunrise. Yeah, we don't have access to Sunrise. Okay. And then
I could bring you
you said it grew from
It grew
what
from-
centimeter to what centimeter?
last June of 2023, it was 1.6, 1.0. Then it was 1.7, 1. Now it's 2.0, 1.2.
1.2. Okay.
Yeah.
So you went to
2.0 times 1.0.
So 1.6 to 2.0.
Yes.
Okay.
I know, that's a big change.
And then when was the last imaging of your adrenal gland then? This year?
It was at Sunrise and that was it.
Okay.
Yeah,
Okay.
so I need a washout, whatever it's called.
Okay. All
And it hurts right now. This
and
is
then
hurting,
you
this
never
is
get
killing me.
biopsy, you never
Ever.
follow with someone else, and okay.
No, never. This is my
Okay.
first time, all new with cancer. I know my body, I have intuitive personality, so I sense things without having no documents. Like I know things.
You have a 2-person
No,
personality.
it's called intuition. I was a kid.
Intuitive. So you have 2 personalities.
Intuitive. It's a personality like you have 5 senses. I have 6 senses because I know things without knowing things. I know my body very well.
Okay.
And then I know it because I got proof because when I went out of state, they saw the tumor too, and they said it was something like that, fibroids and stuff.
Did your primary doctor work up for adrenal gland issue, or did they never?
She was going to. They were all going to, but that stupid one doctor, no offense, didn't like me, so it all changed the whole thing.
Okay.
Changed my course of plans.
What symptom of adrenal gland that you have other than pressure?
Fatigue, weakness, very high blood pressure, low blood pressure, high blood pressure, low blood pressure. It's usually high, but I can feel it once in a while drop. I just know my body very well.
Are you like gaining weight?
Yes, that's what I'm saying. I was like 129 because I was losing weight. And then all of a sudden I'm now gaining weight.
How long you been had the symptoms? How many years?
Well, this just last few months.
Last few months.
Yeah.
Okay.
The bad, like it's really painful.
Fatigue, worsening, gain weight, hypertension.
And then low can be.
Okay. Okay.
Just a mix of everything. And
Okay.
I know my pituitary somehow, because I did fall not that long ago and I didn't hit my head, but it was a soft fall. It was just walking down the street and it was a soft fall. But I'm thinking, well, maybe it rattled it again. Maybe, I don't know, maybe with my brain traumatic injury, maybe it just.
So I'm telling you, the pineal gland is really center of our brain. Just whiplash is not causing like prolapse or anything.
Not prolapse.
Yeah,
I didn't say that.
yeah, like blue pineal gland. Yeah.
Well, that causes a lot of trouble and I want it fixed.
Okay.
You know, I know my body. I just want it looked at, like the ER said too, get it checked
Okay.
deep down.
All
Because I'm
right.
feeling a lot of pressure and blurry vision,
Mm-hmm.
and that has to do with the pituitary.
Does that blurry vision all the time? Is it in the
No, it
morning,
comes and goes.
afternoon? What, any
Anytime.
triggers?
And
Comes and
anytime.
goes? Did you see an eye doctor outside?
Nope.
No.
Because I know it's my pituitary. I just know my body.
Yeah. I mean,
I never wore glasses, never done this, never done that. So
You don't wear glasses? Yeah.
I don't wear reading glasses. It just now I started to just now
Yeah.
because to relax the eyes more. But I'm telling you that has to do with pituitary and on my body.
I mean, it can be.
It is.
It can be, but there are other causes of blurry vision too.
No, I know my
just-
body. It's pituitary. I could tell that.
Okay.
If I didn't have the intuition, sixth sense, I'm gonna be like, okay.
Any bleeding in any vaginal bleeding?
Hematoma I have. So
Not in your urine, vaginal bleeding.
no,
No.
just in my urine.
just the urine.
Yeah, that's why it's
For how
uterus.
many months or how many days?
For the uterary, for the.
For bleeding blood in your urine, how many
Oh
days?
gosh, at least a year and a half.
Oh, a year?
Yeah, it's been happening for a long time.
Okay.
And I never had a UTI.
Is it all the time or it comes and goes?
It comes and goes, but a lot of it stays. A lot of it.
Okay. Is it a lot of blood or it's just
A
like
lot of
a
blood.
lot of blood?
Yeah.
What color do you see? in your-
It's mostly they see it. They see the hematoma, whatever it's called.
Okay. Okay. Any burning sensation when you pee? No. No urinary frequency, urgency.
Oh yes, frequency going, or have it if I like now recently, like if I sneeze or something, I might pee a little bit, or like if I laugh,
Uh
you know what
huh.
I mean? That's never done that. That's my bladder. There's something wrong. I mean, I'm telling you.
any recent antibiotics for any UTI or anything?
Nope.
Did the primary work it up for blood in your urine? Did they work it up? Did they get imaging of your blood or anything like that?
Yes, that's where I gave you the paperwork, the bladder. See all that? That's
Oh,
what they
it's
found.
okay. Okay.
So this is why if I fix this, this gets rid of a lot of problems.
So this is adenomyosis. I'm not gonna cause it, but what my understanding is, the lining of the uterus become more muscular cells. I believe they need a biopsy. But yeah, you need a referral.
I need a hysterectomy to get everything out.
Yeah. Okay.
Let's get that out. I was on the verge.
Any gynecology you've been followed before?
Yeah, OBGYN Paula, she was awesome.
Polish?
Yeah, Paula, she's from Southwest Medical. She was going to, I'm gonna,
Okay. Got it.
here.
Well, you need